We are Team 4, and today we will be providing you with some information on an emerging technology called the MYO Gesture Control Armband, otherwise known as the MYO band. Today we will cover a description of the device and how it works, some examples of current and intended uses of the device, how the MYO armband has been applied to occupational therapy, and a case study to demonstrate the creative applications of the MYO armband. The MYO armband is a wearable technology initially developed by the startup company Thalmic Labs of Waterloo, Ontario. The armband allows the wearer to control various types of systems using only arm movements. The armband contains sensors that read the electrical activity of our muscles. This allows for the recognition of different hand and arm gestures. Once the device is calibrated to a specific person, it can be connected to other systems using Bluetooth to control them wirelessly. The MYO armband costs approximately $250 Canadian and can be shipped worldwide. We will now go into some examples of the current uses of the MYO armband. The MYO armband can be used to control prosthetics. It can also be used as a controller for personal computers. The armband has also been applied to robotics as a remote control. While there is a lot of potential for this device in occupational therapy, there is little in the way of literature for its use in practice. Pause now and click on each of these to learn more. Joseph, a 35-year-old graphic designer, was injured in a recent motorcycle accident. Due to the accident, his left hand sustained crush injuries and his right and dominant hand was amputated. These injuries have prevented him from working as a graphic designer and engaging in his favorite pastime, playing video games. Since the removal of his cast, he has been visiting a hand therapist to improve function. However, he lacks the motivation to fully engage with his exercises. Pause here to examine Joseph's case using the WHO's International Classification of Functioning, Disability and Health framework. The occupation of playing video games will be used as a means to develop Joseph's skill with the MYO armband, and future ends of return to work and the possibility of prosthetics will be explored. Since playing video games is also a leisure activity for Joseph, the ends of playing video games with his friends will be enabled through the use of the MYO armband. Being able to engage in activities with his friends will also help shape the attitudes and social environment Joseph faces. Following the crush injury of Joseph's non-dominant hand, the MYO armband can be wirelessly adapted to his house locks to enable locking using pronation and supination rather than holding a key with a key grip. Modifying interfaces at work to be controlled by the MYO armband could also enable Joseph to participate in his occupation. In terms of advocacy, there are multiple avenues that can be approached by an OT. Promotion of policy change to ensure funding for MYO armbands, promotion of accessibility projects through DIY forums, the organization of community support such as hackerspaces or hackathons, both of which bring the expertise of the community to bear on design challenges. Thank you for listening to our presentation. Hopefully the use of MYO armbands will expand what is possible for occupational therapists and their clients in the future.